We begin tonight with a story that could affect virtually every woman. Today, the American Cancer Society revised its guidelines for screening for breast cancer, a disease that kills 40,000 American women every year. It now says that women should get their first mammogram years later than previously recommended. We asked our Dr. Jon LaPook what's behind this change.
Ready? No.
Ready or not, today, 49-year-old Kimberly Taylor finally got her first mammogram.
I really took the advice of the doctor at first, in consideration, but it was very confusing.
In recent years, medical groups have disagreed about when to start screening and how often to do it. A major task force has suggested mammography every other year starting at 50. The American Cancer Society previously recommended annual screening beginning at 40. Today's new guidelines recommend women of average risk be screened annually starting at 45, then every 2 years starting at 55. Dr. Kevin Effinger of Memorial Sloan Kettering Cancer Center chaired the guidelines panel.
From 45 on, we felt that annual mammography gave us our best chance of both reducing premature mortality as well as balancing out with the potential harms associated with mammography.
Those harms include false alarms leading to unnecessary biopsies and surgery. Estimated lifetime risk of dying from breast cancer is 2.7% with no screening and 1.8 to 1.9% with today's new guidelines. The Cancer Society left room for screening women younger than 45.
Between 40 and 44, breast cancer is less common. There is still the risk for a false positive, and so we thought that that needs to be an informed, shared decision between the woman and her healthcare provider.
Women in higher risk groups would need more aggressive screening depending upon the severity of the risk. But for routine screening, today's guidelines narrow the gap between the Cancer Society and the major task force advising the government. A better consensus may lessen the current confusion.
Jon LaPook, thank you, doctor.